American Falls High School is out for Power County. The important thing to remember is this is where we really plan to do these for real. So we've exercised what we really want to do when pandemic flu comes around. So that really talked about what we wanted to do. Now we want to talk about what actually did we accomplish. And the bottom line is we accomplished about 95% of what we really wanted to do. We had a public education campaign. We had our blog exercise. We had a tabletop exercise with the Funerary Industry, and that means the funeral directors, coroners, cemetery managers, everybody who's involved with the death process. We ran the communications checks throughout the district. We established the alternate care sites, and then we had some emergency operations center training at the health district, and we're really plugging along there. And what happens there is the folks who do the emergency operations center at the health district don't have that as their daily job. So they come in, they get some information and practice it, and then they leave and they retain about 10%, so it's slow marching forward. But we're getting there. And then we had a few other full-scale exercise events that we'll talk about in a bit. One of the highlights here, we did a blog exercise, and that has the website right up there, and it's still active up there on the internet. You can go to that web address, read all of the comments about personal preparedness, business preparedness for continuity of operations, a lot of good links for
any education on pandemic flu. I was just on the blog, and even though the exercise took place last month, you could still go on to the blog and just kind of see what took place and just kind of educate yourself and see what great tool that was, and people commented back and communicated and things like that. And then there's those videos that are on there that they can download and see those mock scenarios that you would see in a case of pandemic flu. So.
Yeah, the videos are really the highlight of that, and the links for individual family preparedness, good checklist there, and the business continuity of operations. Yeah, go to the website. You'll learn everything you need to know. All right. So talking about specific tasks now, we wanted to educate the county EOCs and the hospitals and the general public on pandemic flu, and the slides are probably a little bit small, but this tells us what we wanted to do and then how we did it. It also has a related target capability because we're not dreaming all this stuff up. It's stuff we are told we have to be able to do. Yeah. So in educating the county EOCs and hospitals and general public, we had the blog exercise where we put information out there. Everybody could go out there, including general public and the citizens. The hospital infection control officers were involved with the inputs from the blog exercise, where I told them they have a sick person that under a certain scenario where they went camping, their symptoms are similar to West Nile and pandemic flu, but pandemic flu hasn't officially reached the state, so what could it be? It's to make them exercise their surveillance and investigation. We had a trade table at the Pocatello Chamber of Commerce where we could reach all of the businesses to talk about continuity of operations there. If the businesses don't plan appropriately, they can take a huge hit on their revenues and possibly go out of business because nobody's going to be buying a lot of stuff during a pandemic. They're going to be home sick. They're not going to be working, so they're not making any money, so they don't have any money to spend. So that it's very important to have business continuity of operations plans in place. When we establish staff, equip, train alternate care sites, the staffing of it didn't really happen because the staffing, we're already short on medical staff on a daily basis, and this was kind of a build it and they will come thing where we want to be able just to establish, equip the alternate care sites. So our main item there was 3 counties completed this specific task as it was intended, and then we had a couple that we had to reschedule due to events, and then 2 other counties did a walkthrough and said, well, I would have my cots over here, I'll have my doctor's office over there, business office over there. But the idea is to get floor plans, and that end result will be pretty close to what we wanted at the end. And also it's important to point out that Fort Hall did complete their tabletop exercise also, and they created a plan also before the exercise started, so that's one step further than we were before. More specific tasks. Another highlight, we had that tabletop exercise with the funerary industry, and the planning numbers for this indicate that there will be a 30 to 35% attack rate from the virus, meaning 30 to 35% of the people are sick. Of those 30 to 35%, 2% will die. And that comes out to like 1,200 people in the 8 counties in Fort Hall that we have. And the idea was to talk to the funeral directors and cemetery managers and coroners and ask, is that a problem? Can you handle that?
Well, in some of those funeral homes, when you take away 30%, you take away basically
their people
one
too.
person. Yeah, so you even have the workers that are going to be affected. So
we wanted to ask them, are you going to be able to handle the bodies that are coming to you with your people sick? There's a lot of bodies, and there's still regular deaths happening. And the outcome of this was that really those numbers are about double of what the annual death rate is anyway. They would be very, very busy, but they'll be able to do it.
Yeah, and they're going to have to join forces.
But the bottom line is they can do it, and that was good news for us because it allows us to focus planning efforts on elsewhere. We had the Idaho National Guard Joint Incident Site Communications capability. Their Army guys come with a really nice comm package that allows us to talk no matter what via satellite. We like working with them. We worked with them down in Caribou County because it's an earthquake scenario in April.
Your phone lines are...
all the phone lines went down, and they can come in, set up, and you have 18 computers with internet access, email access, voice, telephone, anywhere you go. And it takes about a half hour for them to set up, sometimes an hour. And this is a really great capability. The reason we brought them in was because the Health District Emergency Operations Center is also a designated regional emergency operations center, such as if there was a 7.0 or large earthquake in southeast Idaho, which tends to probably be over by Montpelier or Soda Springs. We could set up here because Pocatello won't get a lot of rattling, and we'll probably be all right, and then we can use them for the communications, assuming that it goes out. That was a really good thing to have them over here. We like working with them.
And then as part of the exercise, what we do with our Emergency Operations Center is that we have what we call our initial response team, where we have 32 individuals that are within our health district come in, and we have different areas that they are to work. And so we worked along with the pandemic flu scenario, and we fired up our EOC is what we like to call it, and then we have different areas to where we practiced our skills and what is going to be required of us when we're going to be as a support system to the alternate care sites. So it was actually really good practice for us as well as at the health district.
And it was good training. I learned a lot also.
It was very good. And having the GISC there was good. And we have the web EOC where we can at any one time see what's going on around the region with their EOCs and just all the you learn with any kind of instant disaster that communications is always the thing that can go bad, and that's the number one thing you want to focus on. You always have your communications up to speed. So,
and web EOC is a computer program that allows everybody being different county EOCs to get on the computer, update their status, and you can see it on one screen. So it works out really well. You don't have to call anybody. You can just type it in there, and all the questions are answered to 10 different people at the same time. Another specific task was to review the pandemic flu scenarios with special needs agencies and special populations. Around here, we work with the Area Agency for Aging, and it's really a disabilities thing where we want to make sure that the folks with disabilities are taken care of, and the National Organization for Disabilities is our baseline for what we do with those. And we talked about the special populations on the blog exercise on July 18th. We finally also had to finish up deploy and employ the disaster trailers. Each county has a disaster trailer that supports 50 basic life support victims. So 8 counties with 50 is 400, and then